voted by you Best Cosmetic Surgeon for 8 years and Best Aesthetician for 3 years. You can call now to book a consultation. And today we are going to talk about SmartLipo laser body sculpting.
I love it. SmartLipo laser body sculpting. Thank you, Michelle. We're missing Robin Berardini today. She's out ill, but hopefully Robin get better out there in Radio Land.
Yeah.
And we have Michelle. And so Michelle, for those of you who are listening just on the radio, Michelle is our program director. And of course, you listen to her on the news and the director. She's the grand poobah of,
That's
of
my
KSRO,
actual title is
right?
Grand Poobah, yeah.
And for those who may not know, this is a little bit of a high school reunion. You were in high school when you were
You're so silly. I wasn't.
You were in high school when we did our very first show, for KSRO Ask the Expert. So thank you for filling in and being our host.
Yeah, it's fascinating what you do, Dr. Tom, and I really like how you give people confidence and make them feel, ready to go out there and present themselves in their best light.
It's and thank you for saying that. And it's so interesting that you would say that, because I was just speaking to a patient of mine who happens to be a nurse, and was just talking to her about the possibility of coming on and joining our team. And we were talking about sort of the philosophy of the office and so forth. And up above, along our waiting area, very top is written our mission statement. And you would think I have that for the patients. I actually have that for the staff.
That's great.
And it's really about how we improve our patients' self-confidence by enhancing their self-image through advanced technology in a warm and secure environment. And really what I love about this particular patient, happens to be a nurse, is that she's really nice, and I think that she'd be a good fit. And that's all about trying to do good for other people,
Yeah,
and that's
great.
enhancing their confidence. So thank you for filling in.
Absolutely.
And you and I, I'm trying to think back, some 16 years ago, whatever it was that we worked together. And SmartLipo came out in 2007, and so I was very fortunate to be the first surgeon to introduce laser liposuction, or SmartLipo, back in Northern California, way back in 2007, and have done close to 1,000 procedures with
That's cool.
this wonderful technology. And so I thought, we haven't talked about it in a while, and let's, we should jump into it.
Yeah, I think so. And today we're going to focus, I know you wanted to talk about using SmartLipo to sort of sculpt your waist.
Yes.
And make sure you've got that snatched look, right? It's so popular these days. Everybody wants to have a snatched waist.
Yeah, I never use that phrase.
You don't use it?
No. But and what's so great about it is I see it on social media and all this and that.
Right?
But there you go, for the snatched waist. So Michelle, when people have asked me, what's your favorite operation? I tell them it's not just one operation, but it's like certain parts of an operation that I like. For instance, I love breast augmentation. I actually love breast lifts, especially for ladies whose breasts are, as someone kind of joked to me, said her breasts were racing to her belly button, okay? And helping those kind of ladies is very gratifying.
Yeah.
The one area with laser liposuction or SmartLipo that I really enjoy is recreating the waistline. And I will tell you that both in women and in men, if you can recreate the waistline, they love it. And they love us. Of course, I do this it's all about me. I want people to love me.
Yeah.
And so it really makes a huge difference reconfiguring or helping somebody to restore back their waistlines of a more youthful or a healthy period in their lifetime.
Right. Now, can you tell us what is the difference between like regular liposuction and a SmartLipo?
SmartLipo. Okay, so great question, and so let's go back into 2007.
Okay.
All right. So I was, for those who may not know, a previous general vascular transplant surgeon. Always liked new technology, so transplants were the big thing in the 80s. In the 90s, my partners and I, we performed the first laparoscopic gallbladder removals in Sonoma County, and that was one of the latest and greatest. And then lasers came along, and so I opened up at that time the Aesthetic Laser and Vein Center, Michelle, and that's when you and I met.
Yep.
Now we've renamed ourselves Dr. Tom Cosmetic Surgery, but we used to be the Aesthetic Laser and Vein Center, and we were using lasers for treating veins, and in particular for one type of vein procedure that people would kind of think of as, they're called stripping. People, I had my vein stripped. We were able to use a laser under local anesthesia to close down the vein that was traditionally stripped. Okay, so I had a lot of experience with that. And so I was ripe for a new technology that came out in the mid-2000s, and that was SmartLipo. So SmartLipo is, number one, performed only under local anesthesia. That's the beauty of it. So it's all under local, and that's how I got involved with it. And what SmartLipo is utilizing a laser after injecting an area that we want to treat with local anesthesia underneath, is using a laser, and we would go underneath the skin through a tiny little needle holes, and we slide this laser fiber underneath, in the hopes of melting fat, and also running that laser fiber directly under the skin to get some skin tightening and also to get a smoother result. One of the potential negatives of any kind of liposuction is maybe having some irregularity. So the laser helps to minimize that surface irregularity.
Oh, good.
One of the misconceptions that the lay public thinks, and that's why I think you asked the question of what's the difference between SmartLipo and regular lipo, is that with regular liposuction, many times it's performed with larger suction tubes. We call them cannulas. So if you take a pen, I don't have a pen here, but if I were to have a pen, and we're on YouTube as well, so you can listen to that. But if you were to take like the cap of the pen and you were to look at it, it would be a large tube. And although it could more quickly, I should say, not necessarily effectively, but more quickly remove fat out, there was more trauma because there was a big cannula, and as well as more bleeding and those kind of bruising and those kind of issues. So using the laser, the concept was that we would melt the fat, tighten the skin, or get a smoother result with the skin. But then because of the liquefaction of the fat, so we've emulsified the fat, we would take smaller cannulas that maybe are half to a quarter of the size of traditional liposuction cannulas, and we would go in to suction the excess fat.
So it's a process where you're using the laser to heat, liquefy the fat, and then you go in and you actually then remove that fat.
That is correct.
Process.
That is correct. And so now we're taking this smaller cannula, so there's less trauma to the body. And just think about it. I tell people to think about it as if you had a bowl full of Jell-O. And so you take one of those really big straws that maybe they serve those. What are those teas?
The boba.
Boba tea. Yeah, boba tea
big,
straws.
Big straw.
Remember my daughter when she was in college, that was the big thing. Right? So one of those big straws, and go in and suction, go through the Jell-O and suction the Jell-O out, and then take a smaller one like a cocktail straw, if you will, and go in and suction that. And what's going to give you how long will it take using the larger tube or the smaller tube? With the smaller tube, it's going to take longer, right? But when you look at the contouring, it's going to be more homogeneous and it's going to be smoother. So in some ways, it's a little bit more accurate or more precise. And so for those surgeons who perform SmartLipo, you have to be more patient. You can't be in a rush when you take care of your patients. Michelle.
That's so funny. I'm going to interrupt you because
go ahead. No, please.
My uncle was a pediatrician dentist, so we did work on little kids, and with that patience aspect of it. When he would administer like a Novocaine, because I one time had to go and have him, even though I was in college at the time, I wasn't a kid. I went and I had some emergency tooth stuff that had to be done, and he administered so slowly that shot of Novocaine and so patiently that I didn't feel any of that. You know how the dentist says, oh, this will pinch a little bit or hurt, and sometimes it really hurts? Like, he had that hand, that patient, slow, caring hand that I did not feel anything.
And that's great that you should say that and tell us that story. Because usually when you want to have a procedure, let's say, oh, I'd love to have some body contouring. I'm going to really listen to Dr. Tom and Michelle on this show about it. But you have some fears or what we call objections. So one could be money, and call the office. I think we're very, we offer a good bang for your dollar, in what we offer. Number two could be a fear of being hurt or pain, And so it's interesting you should talk about your pediatric dentist uncle, was it, that you had mentioned? So I'm gonna say a big thank you to the late Dr. Stephen Davis, who was a dentist here in Sonoma County in Santa Rosa. And I actually would attribute it, and he loved it because I tell him that I would say this to my patients. I would attribute my injection of local anesthesia technique to him. And that's one thing that dentists, I think, are actually trained better than physicians in terms of administering local anesthesia. Local anesthesia, when you inject it, I use the tiniest needles that are really made. So one, a very tiny and sharp needle is important, so you barely feel it. Then I will have to tell you, as a general surgeon, when we did things under local, and my program where I learned was really state of the art. So we were doing more and more things under local, way in advance of the general medical community. Okay, but we weren't taught to inject the local anesthesia slowly, because the patients were somewhat sedated, where I don't have my patients that sedated, okay? So they're more awake. But if you inject quickly, it hurts more. It's the spreading of the tissues. So the technique that your uncle and Dr. Stephen Davis, who is my dentist, because I'm a weenie in the dentist's office, okay? So I love them, okay? But you know, little pinprick and then slow injection, okay? You barely feel it. So that's the concept of how we perform SmartLipo. So let's kind of get into it, and then we're going to talk about the waist in particular. So what we would do, first of all, you come in for consultation, of course. An examination is important, and we'll talk about who's a candidate and who's not to have a slimmer waist. And then when you actually do come in after our appropriate pre-op screening and so forth and teaching, you come in, and then we scrub everything down sterilely. And then I have in my mind a surgical plan, and I know that there are going to be certain entrance sites that I can reach with the suction cannula and the laser. So I space them out strategically, geographically. We freeze up the skin, okay, and we use that pediatric dentist technique of going very slowly, slow injection. We freeze that up. And then I'm always talking to my patients. So I would do this, say, you're not going to feel anything, Michelle. Let's say we're doing on you. And I would say, now, but tell me if you feel anything. I'll say 1, 2, 3, poke, 1, 2, 3, poke, 1, 2, 3, poke. So I've just made little openings that we will now use a very tiny cannula, and we'll put it through that little opening, and we slowly inject local anesthesia. Okay, so just as an example of what you're talking about, Michelle, a lot of times I'll see surgeons under general anesthesia, they'll use on the pump that we use a speed of 4 to 5. I'm using a speed of 1.5. Okay, and so I know it's going to take me longer, but I know the patient's going to be more comfortable, and therefore afterwards the patient is going to recover more quickly. Okay, and I learned that being one of the very first laparoscopic surgeons in Santa Rosa, Sonoma County, Northern California, is that when we first took out the first gallbladder through a scope, if we did it the old-fashioned way, make an incision under general, they were done under general anesthesia, both techniques, but make an incision, go in there and all, I probably could do that in about 1 hour and 25 minutes, okay, an hour, okay. And we call that in surgery skin to skin, okay. Then we use the laparoscopic technique. Now, we got a lot faster than our first one, but our first one took us 4.5 hours, okay.
Look at that,
we didn't have the best equipment that we have now, all those things. So the first time we're moving slowly. It took us 4.5 hours, and I remember my partner, Dr. Brian Schmidt, and I looking at each other thinking, this is crazy, is this really going to be the way we're doing it, and so forth. Okay, we went to see the patient the next day, and we sent that patient home, where the patient that we would have operated on with the longer incision, they would have been in the hospital 5 to 7 days.
Look at that,
so
amazing.
Even though it took us longer, it was better for the patient. So I have taken that kind of epiphany to cosmetic procedures performed under local. So I know that I'm not going to do as many cases, but that my patient in one day, but my patients will do better. So moving on to SmartLipo or laser liposuction, we inject local anesthesia slowly. Then we take the laser, and as I mentioned, we go in and we will run the laser through the fat tissue, but we also run it, more importantly, just under the skin to try to melt that sublayer of fat just under your skin, Michelle. And by doing that, we also heat up the undersurface of the skin, so we get a little bit of skin tightening. Not a tummy type of tightening, but a little bit of tightening, more than you get with traditional liposuction, and we get a smoother result. Now, I've been doing this since 2007, okay? And so when things come out, there's marketing things, and there's a buzz, and, and if we've lived long enough, we know that, some of it's true and some of it doesn't pan out. So I will tell you that I still use the laser and I still love it. But now I know that taking the laser on the deeper layer of fat probably is not as effective as we
Oh,
thought.
okay.
But again, you're anesthetized, but again, you just keep on adding and modifying your techniques. And then we take a cannula that's a little bit of a raspy at the end. And I can run my finger on it, it doesn't cut anything,
Okay.
but it's just a little bit rougher.
Right.
And what we do is we take that and we go mechanically under the skin where we were using the laser, and we emulsify the fat or liquefy it. And it's actually more effective. So I still use the laser as SmartLipo, but I use it underneath the skin for a smoother result. But then the thicker area, I will go in and I will emulsify that area with a mechanical
Tool,
I call it a liquefier.
Okay.
And so that's what we do, and then we suction out the fat, and then and the patient doesn't feel anything. One thing that I will say, doing it under local, because some people say, oh geez, that scares me, doing it under local, is that I have to be more gentle. Think about somebody's asleep and going in and doing it versus that if you go outside of the area of the local, the patient's going to say,
they're going to feel it.
They're gonna
Yeah,
say, ouch.
right.
And so so I tell patients that it does take longer, but I feel that surgeons have to be more careful when they're doing it under local. And again, the risks are fairly minimal, but whenever you hear about something bad happening with liposuction, it's usually done under general anesthesia or the patient heavily sedated, so that there may be an inadvertent placement of your cannulas. With procedures done under local anesthesia with SmartLipo, if you go outside the area of local anesthesia, which is just all in your fat layer, the patient's going to say, ow.
Right.
And so you're going to know. And so in my opinion, it makes this procedure so much safer than traditional liposuction.
Great.
Yeah.
So let's talk about, who is this for?
Okay.
Who, is it a certain BMI? Like, what are you talking about?
So it's for everybody.
It's for
right?
everybody,
It's
okay.
for everybody, because with laser lipo or SmartLipo, one of the biggest areas that demands where people feel pain is their abdomen or their waist. Okay, so it's that fat in the front. Okay, it's on our waist. Put your hands on your hips, everybody. If you're not driving, put your hands on your hips or keep one hand on the wheel. Okay. And the other area is the muffin top, or the fat above our jeans on the backside, okay? And unfortunately, since COVID and the pandemic and all those things, I begin to see a little muffin top there, so I'm gonna have to train my team to do SmartLipo on mine. But what it is that if we can reduce that 360-degree circumference of fat tissue, it gives you a more contoured waist, okay? And just genetically, that's when we look at ourselves or other people look at us, that's what we perceive as being healthier, okay? And so by doing that, we'll fit better in our clothes. We'll fit better in our clothes. Of course, you'll look better in a bathing suit and all those things, but it's amazing, Michelle, and I'll talk just about women now, that when I first started doing this, I thought, okay, everybody's doing this because they want to look better naked or look better in their bikini. And most women coming in to see me said, I want to feel better in my clothes.
Absolutely.
That's what they say to me. And I remember having a grandmother come in. She's probably was my age now, and I took care of her way back in 2007. And I remember her saying, Dr. Tom, I just want to fit in my clothes better. And I have her for before and after photos with just her tops on. And in one photo, she looks very matronly. And the other one, she still was a larger woman, but she just looked sharper. And you could just see that, just the way, and I didn't show her face because these are before and after photos with some anonymity, but with her permission. And I just remember that you could just see the confidence by the way she was standing up with her kind of cool blouse on that she had. And so that's really what people find, is that they feel better in their clothes. They don't feel as uncomfortable. They feel more youthful, and they feel healthier. And I find that across the board, whether you are thin, whether you are what some people may say regular size, or whether you may be heavier, that people feel better. And in fact, having grown up in the 60s and 70s, do you know who Twiggy is?
Yeah, I know who Twiggy is.
You know who Twiggy is?
Very thin model, yes.
Really, right. Thin is in. I think that's when
yeah.
that came in. Thin is in, and really tiny. So I grew up in that Twiggy era, okay? And so I'm kind of thinking in my head, even for myself, you know, kind of is emblazoned in your brain, thin is in. But I found that doing SmartLipo has made me become to appreciate more full-bodied people.
Oh, wow, that's
And
great.
it was really interesting because you would think that, oh, he just thinks everybody's supposed to be skinny, right? It was really great to see how it just made somebody feel better. But for me, visually looking as a third party at my patient, how it's really about proportions. By just reestablishing healthier proportions, okay, the patient looks better and they feel better. And that proportion ideally, okay, and you know, who's ideal? But that proportion is that our waist should be about 50 to 60% of our hips. Okay, it's just sort of as an idea. And we all know as we get older, whatever, life or our genetics, that's not always the case.
Right.
But if you can just incrementally kind of move in that direction, you don't have to be 0.5 or 0.6, but if you can move in that direction, it makes a huge difference on how people feel about themselves.
Right.
And what's great about SmartLipo is that after a couple of days of feeling uncomfortable, you know, you're still feeling it for about a week, but you're up and moving about. You have very little downtime. Most people are back to work 3 to 4 days after the procedure. People really love the results.
That's so great. What is recovery like? So do you have to wear any compression things? What do you have to do?
So I think you still remember this from 17 years ago
Maybe.
when we were talking.
Maybe a little.
Maybe a little bit. Okay. So compression is huge. Compression is a huge component of it. So we will have you order some compression garments, which are like a real tight spandex.
Okay.
And it is important to do because that helps to minimize postoperative swelling, and it actually helps the contour. It actually helps the contour. And I saw that firsthand. So on my wife, when we did this many years ago, poor thing, had to be one of my first patients in 2007. And we did that for her, and she was a teacher at the time, and so we did it in the summer. And so wearing a garment in Northern California summertime, you know, it's not always the easiest, but she felt more comfortable with the garment on, okay? And we, at that time, were recommending to patients that you wear it day and night for 2 weeks, okay? So she wasn't OCD about it, but because she felt more comfortable with it on, more secure, she wore it during the day for about another month, so about 6 weeks total.
Oh, okay.
And of course, living with her, I actually could see her shrink wrapping down.
Wow.
So I know that's only one case.
Right.
That's not a large series study. But from that experience, I have now recommended to my patients 2 weeks minimum of wearing a garment day and night. But then after that, if you could wear it most of the time during the day for another month, that can make a huge difference in terms of how quickly you achieve your results.
And how long will these results last?
So the results should be permanent in that once we remove your fat cells, they're gone.
They don't show up again.
They don't grow back, okay? But if you gain weight, the residual fat cells that are there are going to get bigger.
Right.
So you don't do lipo or SmartLipo in order to lose weight, okay? Because fat is very light. Think about cleaning a chicken, and the fat kind of, when you're taking off the skin, it floats up to the top, right? The fat floats up to the top. So really, it's about contouring, and as you said, liposuction, contouring, I think is what you said at the beginning of the show. And so what we're doing is we're contouring, so you have to maintain your weight. And what I tell people is a third of the patients, they maintain their weight, they're happy with the results. A third of the patients, if they can lose a little bit of weight, and I'm not talking about 30 pounds, you know, you lose 3 pounds, 5 pounds, whatever. Then they really love their results because those residual fat cells are getting smaller as well. Unfortunately, about a third of patients, they gain weight, okay? And that's just human nature. And so they're not going to be as satisfied with the result. But let me just say that as an exaggeration, let's say we sculpt your abdomen and your waist and your backside, and so now you have a little bit more of a curvy figure, okay? And as an exaggeration, you gain 100 pounds. Well, areas where you have more fat cells, like your arms, your breasts, your butt, and so forth, might get a little bit bigger. And so people say, well, that's why you don't want to do lipo, because it's going to go other places. Well, the key there is that you gained weight, okay, which you shouldn't be doing, all right? But here's another point. Because you have less fat cells in your waist, you're not going to gain as much volume in that area.
Interesting.
So even though you're going to be bigger, you're still going to keep that contour. So it depends on how you want to spin this, okay?
Okay.
So it is permanent that those fat cells are gone.
Right. Okay. What about cellulite? Can it do anything for cellulite?
So for cellulite, I will tell you, unfortunately, Michelle, cellulite is just a tough one, and we've looked at a lot of different things, and that SmartLipo for cellulite that's not an indication.
Okay.
So that would be one of my least favorite areas to treat with SmartLipo,
right.
And my favorite area would be the abdomen and the waist and
right.
the muffin top area.
Great, great. And it also can be used in other areas too, which we haven't really gotten into
right,
today.
It could
but
be on the
like
hips.
the what do you call the waddle? Is that, do we even use that word
underneath
anymore?
The chin, or what we call the submental area, so underneath the chin. That can work very well in that area as well. We can use it, we said, on the hips, or what we call the saddlebags. Okay. Ladies might know what that is more than men.
Right.
We can use it in those areas as well.
Okay, great.
Right.
There's really cool pictures at drtomcosmetic.com. You should go and look at the before and afters because they're lovely. And people can reach out to you for a free consultation.
Absolutely. Just give us a call. We'd be happy to talk to you. And Michelle's going to move on over down to the control panel. Again, I want to thank all of you for listening. We really appreciate your support. SmartLipo, we haven't done a show on it in a while, and I have to say it's still one of our most frequently asked for procedures, and it is great for helping to reestablish the waist. But we are a team, so you have to have a healthy lifestyle, keep your weight in balance, but we can certainly be that icing on the top to help you to achieve the look that you're looking for.
All right. Well, thank you so much, Dr. Tom. It was really fun to chat with you about this topic again.